For those who may not be aware, Goodwill has quite a bit of co-working space. And if you're interested in learning more about that and taking a tour of the facilities here that might be a benefit to you and your nonprofit, gather afterwards just out here in the foyer, and someone will be there to take you on a tour. For those I haven't met yet, my name is Peter Blair, and I'm blessed to be the president and CEO of the Linwood Foundation here in Charlotte. We own and operate the Duke Mansion and the Lee Institute. Lee Institute exists to help nonprofit and civic leaders across our region dream big, operate strategically, and accomplish worthy goals. We achieve our mission through leadership development work like the American Leadership Forum. I see several senior fellows from ALF here in the room today, and also through convening spaces like the Agility Series. It's a real privilege to open today's conversation. I want to start with something that I've been wrestling with while writing the second piece in a three-part series on the state of our sector this year, because I think it's exactly the right question for today. The headwinds facing our sector are real, and they're converging. Since January of 2025, nearly 3/4 of nonprofit organizations have seen demand rise for their services, even as roughly 30% have reduced staff, and more than 1/4 have cut programs outright. Federal grant terminations have topped $49 billion. And as we knew and stated at the outset of the Agility Series, foundation funding hasn't filled the gap because it can't possibly fill the gap. The chasm is too big. Additionally, nearly 60% of nonprofit CEOs say that it's become harder, not easier, to secure funding from foundations and grants. As the kids say, that tracks. As foundations and grant providers have faced a deluge of funding, as more nonprofits seek their support in a constrained environment. This funding environment isn't the same shape as the crisis of 2020. COVID was a storm that for many, you could really, quote unquote, put your head down and duck and get through it. It didn't hurt that the federal government stepped in to provide millions of dollars in PPP loans and employee retention tax credits. Did you know that more than 6,000 nonprofits in North Carolina received over $810 million in PPP loans? And then an additional nearly 25% of North Carolina nonprofits applied for and claimed the employee retention tax credit, the highest utilization rate of any state surveyed. This funding, while essential to keep our great organizations running and meeting the needs of our community members, also had the effect of kicking the can down the road for many nonprofit organizations who didn't have to face the hard questions about program efficacy, efficiency of resource allocation to impact, or the engagement of our boards towards the achievement of our missions. The challenge we're living through now is vastly different. This time it's structural, not seasonal, and therefore that changes what is required of leaders. Psst, that's you. Here's the harder question I want to leave you with before we go further. How much of what your organization is feeling right now is truly caused by these external headwinds? And how much of it is internal strain that predates this moment? How much of it is truly caused by external headwinds that were simply, or again, how much of it is internal strain that predates this moment, and we're simply attributing now to the sector's problems because it's a convenient shared story. I ask this with real compassion because I've had to ask it of my own organization ourselves. It's easier to say the sector is under siege than to ask, are the challenges we face related to cuts in federal funding, including a trickle-down impact, Or is it because our board isn't actually engaged and they're just approving what staff brings to them? Is it related to a more competitive grant environment? Or did we fail to build the reserves we should have built in the good years? Is it related to a change in individual donor behavior as they shift to support the social safety net Tracy will soon describe? Or is it because we're holding on to a program out of ego rather than impact, failing to sunset a program that we knew long ago no longer had the deep and broad impact that it once did? Are we refusing to cede territory to a peer organization doing the same work more effectively? I ask this because for some in the room today, these external forces and headwinds are real, meaning their budgets were heavily weighted towards federal grants and the cuts to those have a real impact. While for others, and I would surmise the vast majority of the nonprofits in the space in our region, they didn't receive federal dollars. And so the changes in that arena are not as directly impactful. As you sit here today, undoubtedly some of what's hitting your organization is genuinely external, and it deserves real shared strategy. But some of what feels like sector-wide crisis is actually a magnifying glass on decisions our organizations made or avoided making long before 2026. The organizations who come through this era stronger will be the ones whose leaders have the humility to ask which of these is true, the discipline to tell the difference, and the honesty to act on what they find. That distinction is exactly why we're gathered today. This session, Agility Together, Preparing for Convergent Headwinds, is going to look closely at a specific set of state and federal policy shifts. Changes affecting SNAP and food assistance, healthcare access, housing stability and homelessness response, and mental health services that could make it harder for the people our organizations serve to get the support that they need. We'll explore what these changes actually mean for our community, and just as importantly, where we have real agency to prepare, collaborate, and respond together rather than absorb the impact alone. To help us do that, I couldn't be more pleased to welcome our featured speaker today, Tracy Russ. Tracy serves as Senior Vice President for Civic Leadership Strategy and Impact at the Robinson Center for Civic Leadership at the Foundation for the Carolinas. That's a real mouthful, and I have no idea how he fits that on a business card. Over more than 25 years, he has built a career at the intersection of civic engagement, community strategy, and public communications. From leading the Beyond Open program, which delivered more than $20 million in small business grants across our region, to producing Crossroads Charlotte, a film examining the barriers to opportunity in our own community. Few people understand the connective tissue between policy, philanthropy, and the day-to-day work of our nonprofits as well as Tracy does. And I'm grateful he's here to guide us through it. Please join me in welcoming him.
Good morning.
Before I hand things over, I'll leave you with this. Today isn't about cataloging everything working against us. It's about doing the harder, more honest work of sorting out what's truly ours to navigate externally and what's ours to fix internally, and then doing something about both together. That's what agility actually looks like in a year like this one. Thank you again for being here. Tracy, the floor is yours.
Thank you, Peter. Thank you so much. Thank you. Good morning, everyone. Oh, now we've got to do better than that. Good morning. There we go. I want to start out. Does everyone have access to a document that looks like this? We're going to use this as a toolkit this morning, and we will post it on the landing page for Agility Together immediately after the session, so it will be available all the time. And just to walk you through quickly what's included, it is a brief description of what we're calling convergent headwinds, meaning the forces that are acting at the same time in our community in multiple ways. But most of the content is around how to build out advocacy and providing messaging around these convergent headwinds so that we can all recruit others, our allies, stakeholders, and unusual partners to help us navigate through these headwinds, just so you know. This is an example of the kind of resource that we will continue adding to that landing page based on our workshops and based on knowledge that we're gathering along the way, and we hope you find it useful. If and when you do not, or it could be useful in a different way, let us know. We're always open to input. Thank you for joining us in person here, and thank you to those online who have joined us. This is the 14th, is that right, Melissa? 14th workshop, and we will keep these going as long as you keep sharing back to us that you are finding value in them. The topics are selected based on your input and feedback, so we will keep that going as well, and we'll keep adding resources along the way until, again, it's not useful. So just to preface a bit what you're going to hear and what I'm going to walk through this morning with some characteristics or notes. One thing to note, what I'm about to describe is complicated in some ways and isn't in some others. It is complicated in that there are multiple changes in programs, agencies, rules, procedures, budgets, etc., that are individually complicated and added up is like, you know, that pile of wire coat hangers that ends up at the bottom of the closet and you're like, oh my gosh, there's no untangling it. We're not going to go into depth into all of the details for two reasons. One, there's a lot. It's a lot to absorb. And two, it changes very, very quickly. So you may hear a headline or see a headline that says such and such program cut by 60%. This is a real example. And maybe that's how it will end up. But what we've seen over the last, especially 18 months, is that's not usually how it ends up, whatever the it is, whether it be a budget, policy, a procedure, an action. So, main thing is to take away that there are multiple forces here. We will do our best to keep you informed of changes as they happen, and we'll do that directly. But you don't need to be an expert in these convergent headwinds. Our purpose is to give you heads up that there are forces that are acting upon our community and other communities that are individually impactful and together are adding up to a multiplied impact for the people that we serve. So that's one thing. Second thing is, as we've shared in this room and other rooms throughout the entire workshop series, there is no magic solution to all of this. There's not a date where, whether it be an election or a leader or a big pile of money that emerges from somewhere or someone, that will change all this, all the aspects of this scenario overnight. There is, however, the willingness and the ability for us to work together and for us to be agile and nimble and responsive. That is the capacity and set of capacities we're trying to build. So while I can't say I'm going to give you, like, here's a big, giant problem that's really complicated and here's an awesome magic wand solution, either way, what I can say is that we're going to affirm that we can face complicated problems. We can face them as opportunities even, and we can do that together. And I'm going to give you evidence that that works, and it has worked already. So there is a lot of reason for hope in all this. And I say that because there's the possibility if you left at about the 20-minute mark in this, you're leaving like, oh my gosh, never do I want to hear Tracy speak again because that was so depressing. There is a lot here, and it is kind of heavy. I don't think it's heavier than what you're experiencing and what you're seeing in your work every day. The simplest way that we have found or exploring to explain what's at work in our community is to use a visual. Hence, our little prop here. These are yours. And if you can envision our community, us, as this sailboat. And as happens with sailboats, there are headwinds which you can navigate forward into. And then there are winds in the sails that will drive us forward. So there are forces acting against our forward progress and those that are propelling us forward. In this example, or this set of examples, there are direct sort of headwinds, and then there are what we're calling undercurrents that may or may not be related to specific decisions, policies, changes in agencies, et cetera, but are more the state of our community, the state of the world as it is right now. So I'm going to walk you through what those are. I'm going to walk you through some of the assets and the winds in our sails, and then we're going to talk about how to leverage where we've got some strength today. So part one is here's where we are. Part two is let's do something about it. Sound good? All right. So, headwinds. There are forces that are coming at us that can, A, cut resources for direct supports and services across a number of fronts. The most visible ones are food insecurity, access to health care, medical care, and primarily insurance is that mechanism, and housing affordability, and homelessness. Now, I'd venture to say that whatever the work is that you're doing, whatever you're focused on, it is either probably directly in one of those three or something very close that's affected by one of those three. It's likely that those that you serve also are in some way, shape, or form affected by all three of those areas of need to some degree. So they're all connected. But you can envision this like the things that are being affected are really like the legs underneath the table, like the big ones. And it is important that we know what's going on with them so that we can try to hold the table up through other means, through other legs, if you will. I'm like a mixed metaphor, bag here, that may or may not be visible as like the direct connection. So, first set of impacts from the federal level is the set of impacts that have been created by the One Big Beautiful Bill Act, H.R. 1. This is federal legislation. Because it is legislation and it's not sort of a yearly budget set of decisions, it has enduring impact. It sets the parameters, if you will, through which federal agencies create their budgets, the rules. In the original set of One Big Beautiful Bill, H.R. 1, there were vast cuts to housing programs, HUD, to medical care access, to food programs, and some of those did make it through to final passage. There's also good news in that some of the worst cuts did not happen. Some of the worst impacts did not happen. And they didn't happen because of advocacy. So when I said earlier that we're going to talk about messaging and why this toolkit is biased towards advocacy tools and mechanisms, that's because advocacy works. And I'll go ahead and say right now, not political candidate advocacy. Do not endorse or oppose a political candidate as a nonprofit. That is illegal. You can, however, educate. That's what I mean by advocacy. But at the federal level, we've got sort of the rules of the road have shifted because of H.R. 1. And they have shifted around food insecurity, access to resources to provide food, housing, access to medical care. That's one headwind at the top. Then we've got this annual set of decisions and ongoing decisions that are within those sort of lanes that are called budget appropriations that happen every year in every agency, and every head of every agency at the federal level, of course, makes decisions about their budget. And they get to set some mini rules, if you will, about how those budget resources flow. At that level, there have also been attempts to make cuts. Not only cuts in actual resources, but additional hoops put up for people to access the resources that are left. And these are things like funding for HUD that is channeled to communities for affordable housing, for down payment assistance, for community building. A lot of those resources do flow through HUD, but not HUD alone. And at that level, we have seen cuts in overall budgets. We've seen shifts in how those budgets can be allocated. and we'll continue to see those shifts. So you've got big national picture at the federal level. Here are the rules of the road. They have shifted. And then secondary to that are budget decisions that are made every year. There's some good news in this second headwind. That is that those decisions are influenceable, meaning our advocacy can change things. And that is indeed what has happened for the good. And I'll talk a little bit more about that. Third headwind, and this is a little bit less of a headwind than it was 90 days ago. Our state, in its wisdom, waited to pass a budget for a long time, months and months and months and months. That didn't help anyone in terms of planning, in terms of actual resources, in terms of being able to be agile based on like what's coming, what's predictable. We now have a state budget. That is good news. What is inside that state budget is a mixed bag of good news, and that could be better. But it is generally good news that we have one, and hopefully that trend will continue. So we've got headwinds that are definitely powerful, that definitely are influential. At the top level, there's not a whole lot we can do about that, the impacts of the one big beautiful bill. Not yet. That requires passage of additional different legislation at some point. And so it's tempting to think, okay, that means like we're going to have an election coming up and maybe one of the chambers will shift in our US Congress and then we can make some different decisions. And I wish I could tell you that that would be the case. It is not the case. It's not an automatic case anyway. Whatever the composition of the Congress is, the provisions of OBA are extremely difficult to shift, and they're likely to be the rules of the road for the next several years. The state level budget is very influenceable, changeable, subject to advocacy, as are some of the federal budget agencies, okay? Then we've got these undercurrents. Is anybody like are you ready to leave because it's depressing already? Yeah. Don't worry, like, we're gonna talk about what we can do, what we're doing about this and what we can do in just a little bit. But I want you to have the context because information is power and we can develop the solutions only when we have the information. The second set of forces that are working against us are what we're calling undercurrents. Things like there is continued inflation. It makes everything cost more. That's what inflation is, meaning that it costs more for all of you, for us, to access not only basic supplies, if that's what we're distributing, but services, the places that we're housed, access to capital, lending, everything. Everything is more expensive, which can lead to a reduction in services and a reduction in the number of people that we can serve, who also are impacted by rising prices themselves. Second, this uncertainty that we're in, economic uncertainty, societal uncertainty, the sense of unease, has led to declining consumer confidence, meaning people are like, if they were going to go out and buy those things at Target or Walmart or all the way up to a car or a new house, they're probably thinking about it a little bit more and delaying those kinds of decisions, including philanthropic decisions, including donations to your organizations directly, setting up funds at places like Foundation for the Carolinas, and their comfort with approving requests from local government for bonds, for other mechanisms. Anything that's like costing money, like everyone's sort of drawing in like, I think I'm gonna wait and see because I'm a little uncertain about what's ahead. Third thing is, and this is ongoing and I don't think is tied to current conditions, it's exacerbated by current conditions, but we have been in a period of decline of social connections, of trust of institutions, of social capital connections between and among us, trust in institutions and organizations for decades. And the fact is that we're less connected now than we have been in some 40, 50 years. Dr. Robert Putnam, who has written many books, and there was a film screened here, thank you, Goodwill again, called Join or Die. It is not meant as a threat, it is meant as an observation that we are better if we're together, but has documented this trend. And he has said explicitly that there are It isn't just that, oh my gosh, we can't have a cookout that would be as much fun, or a birthday party, or that we feel worse or better walking down the street and waving to neighbors. That it has, this erosion of trust and lack of social connection has real economic impacts, real societal impacts, real political impacts. And not only are we paying the price directly for those impacts, but there's opportunity costs, the things that we could have been doing together that we haven't because we're not reaching out, we're not as well connected. This is really important for everybody in this room and in this community to understand, especially around the concept of agility. We can't be agile and nimble and move together if we're not connected. So if you walk out of this room and don't think of anything else, think of this. The people that are at your table are the starting point to build a relationship with. So take advantage of it and do that over and over and over again. If we all do that, we will be in a much stronger position to respond to all of these influences. And it isn't just that it's a nice thing to do or that it makes us feel good. It's that connections have a measurable impact and outcomes. And those connections are the channels through which we can flow resources, ideas, collaborations, partnerships that make all of this work better. So we've got headwinds at our sails. We've got these undercurrents. We're in our little boat. But notice, I don't know if you can see this, but see, there's like spray coming off of this bow where it meets the water. This thing is moving still. It is moving, and we're moving, despite all of these pressures in the opposite direction. We do have some great news in our community that has to do with the wind in our sails, what is propelling us forward. And you know, the simple way to look at this is like, this side, these forces, the wind going into our sails, has to be stronger than these headwinds, right? For us to keep making these little splashes and waves forward. We think that they are stronger because, one, we're in a growing community. That is a vast advantage in the landscape of U.S. communities. It is not a great place to be on the other side of the equation for a city, for a region, to be in decline. Because it means not only is capital, assets, dollars literally leaving the community, but people with ideas, people with economic possibility, economic mobility, people who can connect to others, people who can be donors, board members, volunteers, they are leaving. So it erodes the capacity. Good news here is that whether you say there are 157 people a day or 135 people a day, whatever that number is, let's just say it's 100, that those people who are arriving every day are people that we can connect to, and they can be volunteers, they can be advocates, they can be donors, they can be board members, they can be elected officials, they can be trustees at foundations, they can be leaders of nonprofits. How many people in this room have arrived into the community in the last 10 years? Did you know everybody here and know that you were going to be in the position you're in before you got here? If so, raise your hand. Okay, that was what, about 12 people, maybe 15? There are 85 other people that should be here by midnight tonight that may fit that profile too. So we've got to connect to them. One of the roles that we have at the foundation is to help make that easier and faster. To do that with partners like Share Charlotte, Lee Institute, United Way, and others. We can be a conduit to connect to those 100 people that are coming in. We're in a growing community. That is a good thing. It brings challenges, yes, but we'd rather be in the growing community scenario than the other side. Collaboration, and we've talked about this, and Peter just mentioned this, the power of working together, of establishing partnerships, of finding ways that we could share in not only the burden, but the possibilities around programs, around specific initiatives, ideas that we might have, is vast. Again, in a growing community, we've got more organizations, more people, more leaders with great ideas like yourselves that can join together if we've got pathways for them to do so. But this idea of collaboration is critical. The ideas of resilience, of adaptation, of taking stock of, where are we right now? How can we pivot? How can we adjust? Are there things we might want to let go of? Programs. Are there initiatives that sounded like a good idea at one time, and maybe they are, but It's the 8th thing on our list, and we really might need to get back to the 5 that are at the core. How can we do things differently? How are we looking at others for ideas and options? This ability to be resilient, to adapt to change, is important in a growing community. If we had a growing community and everyone was determined that things have to stay the same as they always have been, and not that that isn't a trend here, but broadly, we have been a community of adaptation, of innovation, of change along the way. And we need to keep that up because that is an enormous strength. And finally, this idea around advocacy, which is not rocket science, but the idea that in addition to reaching out into the community and trying to find more donors, more volunteers, more board members, more talented staff, that all of those constituencies, all of them, and people that we know, friends, neighbors, colleagues, can be advocates with us and for us, and we can be advocates for them. And the reason that is so important is because it works. And I'm going to show you a few examples of that in action. Everybody get the idea? I know like, if this were a physics class, you'd be like, yeah, we got it. Okay. So some specifics about these headwinds that are interesting to know, and they may be important to know, but again, I don't want you to leave and feel like I've got to be an expert on H.R. 1 and budget appropriation cycles and the North Carolina budget, because the trend has been that lots of these decisions shift quickly, and even what looks like a final outcome may not be the final outcome. So rather than spend time trying to be an expert, respond to the trend. There are headwinds. Here's where they're coming from. Around H.R. 1 specifically, there was tightening in resources and cost shifts related to Medicaid, so access to health care, and SNAP benefits. So both a reduction in total dollars and an increase in hoops that individuals must go through to access Medicaid and SNAP benefits. These look like work eligibility, work requirements, meaning I have to demonstrate and show that I am working, to re-enrollment every 6 months instead of every year, meaning you have to go and appear with someone who will walk you through this process of renewing your eligibility and proving that you are indeed eligible for this program. Data show very clearly that the vast numbers of people who lose services and supports like access to health care through Medicaid, and especially like SNAP benefits, it's not because they're ineligible. It's because they do not jump through the hoops. They don't do it fast enough. And that has meant in North Carolina for ACA enrollment, health care insurance, we've already lost 200,000 North Carolinians. We're the biggest county in the state. A lot of those people live in our community. You lose access to health care insurance, and then all of a sudden, like, I don't feel well, I should go to the doctor, but I can't because I can't afford it. That means I may not be going to work, which has effect on your ability to pay rent. And then you're in this situation where I don't know about my housing, and then the food starts to run out, and then your kids aren't going to school, and so on and so forth. So these hoops have real impact. It means something that even if someone is eligible, that they have to show up again and again and again to prove it. I'll leave it to the audience to decide if these things are intentional, but they are real walls that people have to jump over, including us, because we've got to help them. Another part of this to understand is that it makes sense. Like, okay, we're going to embed more process, we're going to have more hoops, but as long as we have people to help others enroll in Medicaid and SNAP, the likelihood that they won't do that successfully will go down, and we might be okay, which is a great theory. Unfortunately, there is a program called Navigators that is specifically designed to help people enroll in Medicaid. The funding for Navigators was cut by 90%. That is a real and enduring impact. Basically, that means it's gone. In real life, that means someone who thinks, I might need to, I need to get that health insurance thing. And I already am kind of a little fearful, don't know how to do that exactly. And in the past, there may have been a 1-800 number or a website with a chat or some way to connect with someone that can say, I got you, like Kimberly, like let's sit together, we'll do this. That person's not there anymore. That hotline's not there anymore. In rural communities, the effects of this will probably be devastating because the number of people that will travel to the next county over, which might be Mecklenburg, to find one of the remaining navigator programs is going to be more challenging, take more time, and probably just won't happen. So we're going to see more and more of that. That's the kind of like background effect. It isn't the direct cut in the resources alone. It's the access to the resources that are remaining. So what does that mean? Here in this county, it means we've got ability to support efforts like the Center for Digital Equity and their Navigators program. For our agencies to understand how these hoops operate, what people need to do and to be able to help guide them through those gateways. There are things we can do about that, but they won't be coming from the federal government as a return anytime soon. And finally, and I mentioned this, that changing any of the provisions that I just mentioned really requires new law. It isn't something that can be adjusted at the agency level or in a budget specifically. It is sort of rules of the road. So, budget appropriations around HUD and around access, again, to food and addressing food insecurity. At the agency level, there have been lots of attempts, and I'll use HUD as an example, to cut back the total resources that are allocated for affordable housing, down payment assistance, repairs to homes, programs to help people stay in place as development's going up around them, all of those things. Good news is that there has been pushback. There were proposals to cut HUD funding, critical programs, by up to 80%. That didn't happen. In fact, some of them have been not only fully restored, but funded plus levels. The way that they have chosen to allocate those additional resources has shifted away from solutions that we are investing in for homelessness to solutions that the agency thinks are the better solutions. I'll just put it that way. The data don't show that, but that's the policy. So again, even in the scenario where there are increased resources, the rules and how they're used have shifted, and not in a way that we necessarily would design them for effect. So what that means on the ground here is that we will see and we will have access to funds to build more housing, build more affordable units. I mean, no one would say that's a bad idea, right? But in the meantime, what's being eroded, and at the same time, are all of the programs that enable people to stay in place where they are right now, to redevelop older apartment complexes and properties, to afford down payment for a house or a home that exists right now. So yes, we will end up with funding for more things to be built, but in terms of keys opening doors, our ability to help make that happen is facing some significant challenges. And finally, on the North Carolina budget. The good news is that these Medicaid cuts that I mentioned have largely been filled by state action, by state budget. In the past, and this is where starts to get into detail, but I'm trying to give you 2 or 3 bullet points at the top of it. But believe me, there's a long, long list. So if this seems detailed, trust me, there's a lot more, and we can provide access to that. But I want you to know about some of these dynamics. In the past, and using SNAP as an example, the federal government paid for 90% of those benefits. The other 10% in our state was paid by a fee that was charged to hospitals. And the state basically came out and said, okay, for Medicaid enrollment, that seems like a great idea as long as the state doesn't have to pay for it, and we can rely on that similar split. Same thing for food benefits. What has happened is that the federal government has pulled way, way back. So that 90% isn't there anymore. It looks more like 40%. And at the same time, in North Carolina, our legislature has decided that if the state ends up having to pay for any part of this Medicaid expansion that we're in, then the whole thing gets dissolved. And that means that we would lose around 750,000 people that have enrolled in Medicaid since the expansion. So it's a real rock and a hard place. Like, we've got to find ways to pay for it, because if we can't demonstrate that we can pay for these Medicaid benefits specifically, then we're going to lose 750,000 people off of health care insurance. So we couldn't do that. There are not too many options. So they dipped into the hospital tax idea, side of the revenue. Again, in rural communities where they have hospitals, they're already facing very dire straits. That is not good news. It could mean that some of them tip over into insolvency and they disappear. Could. What it does mean is that over time, while we fix the sort of temporary solution around Medicaid now, every year that allocation, that fee from hospitals goes up as a way to pay for this. At the same time, every year, hospitals' ability to pay it goes down. So there's a problem brewing. It's not this year's problem or next year's problem, but 5 years from now, it looks like it'll be a significant problem. And then the last thing I'll mention in terms of specifics, has anybody heard of the camping ban? Okay. There is legislation that is still active in North Carolina in the legislature that basically says we are going to ban people camping, sleeping outdoors in any public space or private space. And the way we're going to enforce that ban is through local law enforcement. And what will trigger that enforcement is the ability for one person to call and say, I see people camped out in the intersection at blah, blah, blah. And local government will be compelled to go and remove those people. Don't know to where, don't know where they're going to go, how they're going to get to some other place. So basically, we're just going to legislate the problem away. Passed through the legislature, the governor has vetoed it. It was scheduled for an override vote by the legislature, and that has not happened yet. This is August 4th. But it's still on the legislative agenda. Should that override happen, we're going to be in a very strange territory where it literally is possible for anyone in a community, individual, business, you name it, to say, there are people that are assembled and congregated and sleeping out in any place, and I don't want them there. It's not hard to imagine what that might look like in our community. And we all know that the truth is we can't just legislate a problem away like that, but that's exactly what this is an attempt to do. So it's something to keep an eye on. Where those people will go is unknown. We've got around 450 people. Is there anybody from Roof Above here? And check me on these stats. So around 2,000 that would be classified as homeless, and then 400 or 450 that are out on benches, and those, where would they go? We can't legislate them out of existence, but that's what the logic would seem to indicate. They might go into the adjacent counties where there's no support. What happens? They probably end up in an ER somewhere or a shelter, you name it, and so on and so forth. So it's something to keep eye on. What time am I? 9:40. So we've got 6 areas of impact, and I won't go into a lot of detail on any one of these because I think you get the picture. That around food insecurity, access to health care, not only affordable housing, but solutions for homelessness are being impacted. We have declines in mental health and mental health well-being, and these impacts on our sector organizationally that are all adding up at the same time on a concurrent timeline to challenges, to households, and we've traced out some of the impacts of how that can happen. You don't go for health care, then you don't go to work, then housing's a problem, et cetera. The effects of a lot of these convergent headwinds will be most visible and most impactful in the very crescent that we've talked about now for about 2 decades of the most vulnerable people and communities already. It has impact on us, on providers, and it's all happening at the same time. Now, any one of these things at a time, we have faced a version of before, but not all of them together and not all at the same time. that means these pressures compound. So I'm building up to, when I said it's important that we advocate and that we get others involved, this is all a part of the messaging. So if it seems dire and it seems like something that, wow, I wish people understood that because there's a sense of urgency that can be built from it, this is why I'm sharing it. We've got the details available to you, but the gist and the narrative is, yes, we have faced challenges before, but not all at the same time and not to this degree, and people need to know that. Donors, volunteers, stakeholders, staff, board members, everybody that you're connected to, that we're connected to. It's helpful to be aware of some timeline pivots, but the big picture is that by design, the impacts of H.R. 1, as well as some of the budget decisions made at the agency level, have been intentionally set really not to be observable until later this year, which happens to be after midterm elections. Then we're going to start to see in late 2027, in late 2026, early 2027, a lot of these impacts get real. Further cuts that are already mandated, more hoops, probably more visible impacts for all of us. Point of all this is now is the time for us to be letting people know. Now is the time for us to begin. If we haven't started to collaborate, we've got to act now. We can't wait because not much is going to be different a year from now or even 2 years from now. There may be some victories along the way, but the trend lines are continuing challenges. So we've got to act now. So some questions, and then we're gonna talk to each other that come up. When will things like get back to normal? I'm ready for that too. Like just tired of all this like frenetic, all these changes and the daily trauma, and now you've just told me that the world's ending, and I need sanity back. And I wish I could say like, well, there's a date, and we can all look forward to, you know, November such and such this year, or, you know, blah, 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 29 for significant changes to happen. But the truth is that we don't know. What has been structurally shifted and the resources that have been reallocated or just disappeared don't just reappear overnight. So that means like whatever we're doing right now is probably going to be a part of our reality moving forward for years to come. What, Tracy, if you are just wrong? I hope so. I hope so. I will tell you if I am wrong, there are a lot of people that will also be wrong, including our governor, who is lifting up a special set of program supports and actions soon that are related to the impacts of H.R. 1. You saw some of that in the budget. I mentioned the Medicaid solution, which isn't permanent, but it is a way to get through for now. Hopefully, everybody's wrong and we're about to emerge into a different, awesome tomorrow. That would be great. But we can't count on that. Same thing, aren't you being alarmist? Maybe a little bit, maybe, in this room right now. The intention, though, isn't to scare us or anyone else. It is to arrive into what we're doing next together with eyes wide open in reality. The option that won't work is for us to bury our head in the sand and pretend that somehow things will magically get okay, or an election will take care of things and we'll return to that normal sometime soon. And I just need to hang on to that survival day. That's the wrong thing to do. The right thing to do is for us to act, and we can do that. Can't philanthropy fill the gaps? And we've talked about this. That short answer is no, not even close. So if there were a square that I'm like holding with my arms right now of needs, Medicaid, cuts, gaps, food programs, all the things, the ability of philanthropy in this state, as an example, to fulfill a square like that would be like this. If we all dispersed every asset that we own right now. So that is not going to happen. Is there help? Yes. Are resources still flowing from donors? Yes. Is philanthropy a part of the solution? Absolutely. It looks more like this than writing checks. We'll still write the checks, don't get me wrong. There's a whole team of my colleagues here that do that. I don't think they carry like trunks of cash around. But we're still, at the Foundation for the Carolinas, last year, about $1 billion went out to nonprofits, most of that in our 13-county region. The money's flowing. Philanthropy is doing what it does because that's just what we do. It doesn't look unusual, but those channels will remain open. We are messaging out to our fund holders around these headwinds and around specific circumstances to let them know. That is a part of how we can be an advocate and hopefully increase the resources that are available. But it won't be sufficient to cover all the gaps. And finally, this advocacy, Tracy, that you keep mentioning, my attorney says, like, oh my God, don't do that. So it's important to understand that advocacy, in terms of educating leaders, budget decision makers, political heads, stakeholders, making them aware of these circumstances, how it's impacting the people that you're serving, is not illegal lobbying. That is advocacy. That is education. And instead of being shy about doing it, or scared to do it, or reticent to do it, we need to embrace it. Do not endorse political candidates. Do not oppose political candidates, specifically by name. That definitely will get you in trouble. So don't hear me saying go out and oppose a candidate because you don't like their support of or their policies that they're advocating for. Got it? My legal team are like, did you say that, Tracy? Like, yes, I did. But the point in all this is all these questions, they're great questions, and I wish we had definitive answers that tomorrow on this date will be better. Things are going to shift. But rather than waiting, the real answer is we got to get as close as we can to creating the future that we want, using the resources that we have now, the tools that we have available. Will it be enough? And to go back, will this side be enough to keep us moving forward in the face of these headwinds? I believe, and others believe, that answer can be yes. It will look different. It will be challenging. It'll be difficult. It will mean some tough choices along the way that Peter was talking about. But overall, we've got enormous potential in this community to move forward, to keep moving forward. But we've got to get more of us involved, more people as individuals, more leaders, more organizations, more institutions. We've got to have more of us to move us forward. Of the 3 million people that are in our region and of the 1.2 million that are inside Mecklenburg County, data show that about half are bystanders, meaning they're aware that there are issues, but they're not actively involved. They're not donating, they're not your volunteers, they're not board members, they're not stakeholders, they're not fund holders at the foundation, but they could be if we reach them and if we ask them. We don't need to get all of them to make a big difference. We need to get some of them. 5%, 10% of that 100 people that are arriving, or 150, whatever it may be, to make a big difference. So, it is time for us to talk to each other. I want to preface the conversation you're about to have by offering some specific actions, and Peter mentioned some of these along the way. Like, what can we do? Okay, we don't have a crystal ball. We don't know, but what can we do? First of all, the basics will always carry the weight of any movement forward for us. Sound leadership, getting the financials in order, engaging the board, no cool collaboration or partnership or program is going to take the place of just basic sound leadership and management of any organization. As I've mentioned, we want to equip our advocates, donors, volunteers, board members, with tools, with messaging to get the word out. We want to collaborate in real time, not just talk about it. Don't let perfect get in the way of better. It doesn't have to be a giant initiative. It can be a specific program or part of a program, but reach out and connect. Know what your warning signs are. Specific data points like around your cash flow, around the number of people that you serve that should be like the red light flashing that says we need to do something different. And ideally, you've got options already designed. So if this data point shows up, if we're at this point in our cash and in the account, That means we need to do this, this, and this, and do that with your board. And finally, you have the list that matters, the list that will be the most impactful of people, potential donors, future fund holders, current donors. You have the list that matters. At the Foundation for the Carolinas, yes, we have lists of fund holders. Yes, we know where they are giving and where their passions and visions lie for change. No, we cannot share those lists directly. Can we help inform them of what's going on? Yes, and we're doing so. But the list that will be the most impactful is the ones that you have, the people that you already know, and ask those people to connect with people that they know, the next layer out. That is how we build movements, and that's how advocacy works. So harvest the list that you have, tell your story to that list. I don't think any of this is rocket science or particularly news, but again, this is a reminder, it's gonna be the basics. It's gonna be what we've been talking about now for 13 workshops that will help move us forward, not a different or magic solution. I've mentioned some of the changes that have been made possible by advocacy, and just really quickly, I'll highlight again. The changes that were headed for HUD around housing affordability were massive. They turned out not to be because people reached out, because people started calling their elected officials, business leaders, and others were advocating that that cannot be where we go, and it shifted. Our courts are designed to be brakes on the system, if you will. They are doing so. I will not go into whether or not we think they're doing so in the right way or not. I'll leave that to others. But the fact is that the courts have intervened on a number of decisions that could have had massive impact and either reversed them, stayed them, or put them in some kind of territory where it's really hard for the worst impacts to take effect. And finally, specific legislation that is up for possible override with the camping ban. That's something for all of us to know about and activate our networks around. It will not be a good thing for that to pass for the people that it will affect. And it won't be a good thing in turn for any of us. So we need to reach out to our state legislators and say, that needs to stay an idea that doesn't happen. Okay. So let me stop. Any questions that I can answer in this moment before we work together on a couple of key, yes?
I have a question. You're talking about advocacy making me think of it.
Yeah.
So one thing that we've heard from our supporters about that could be helpful that this administration is doing are these Trump accounts.
Mm-hmm.
And they've said, would you all consider publicizing this to your clients as a way we serve new moms?
Yeah.
So they would be eligible for this $1,000.
Yeah.
I'm curious.
Yeah.
This group's it feels like an endorsement because it's branded
Yep.
very clearly as an endorsement.
Yeah.
I'm just curious.
Yeah. So, and the question was around, should we be promoting the use of what are called Trump accounts? And I will add to that list. Did I get your question?
Yeah.
Okay. There are also funds or accounts that can be used for education that are fundable, that have been provided and set up through legislation from the administration. So these are instruments and ways for people to channel their resources if they choose to do so. They are legal, they have intention behind them, they are designed to address what people think are key needs, right? Future for their kids and education. That's really hard to push against. I would say that you want to avoid pushing back specifically against them unless you provide the description, here's what this is an option, describe it in as neutral a tone as you can, and then describe what the impacts could be. That's not the same thing as saying vote against this or that, or don't do this for your supporters. Your supporters and donors, stakeholders, board members are going to have to do some math and figure out, okay, I get the impacts. That's not an impact I think is a good one, so I'm not going to fund that account. I'm not going to take advantage of it. So again, education is the key there without going into an area where you're either holding information back or you're steering someone toward a specific decision, but you can make them aware of what the impacts are.
What about on the side of like our moms who receive our services, like telling them this
Yeah.
is an option?
Yeah, I mean, it's hard to, you don't want to be in a spot where someone finds out about a resource later that appears to be of benefit and you didn't tell them about it. That's not good. That will probably erode some trust. And it's not that it's not repairable, you can explain why and all these good things, but generally you want to be the person carrying the message forward and controlling the narrative to say, hey, there's an option you might be hearing about. It is designed to do this. It could have these impacts on us, this organization that I know you care about, and on the people we serve. And you will make the decision that you make, but at least you're giving them information about what the option is. Does that make sense?
Yeah. It's just it drew the comparison for me to Obamacare, like 15 years ago.
Sure.
Were nonprofits promoting that.
Yeah.
But I think we could call it the Affordable Care Act, and there's not another name.
Yeah. It's, yes. It is, I mean, and this is why, like, depending on the context and either, what your worldview is, it's okay to promote a program, or it isn't okay to promote a program. So the best thing to do is like share the information as it is and inform people, let them know what the impacts could be to your best knowledge, and allow them to make decisions. But you would be empowering them to make decisions as opposed to them finding out later, and then they're probably not coming back to you for any more guidance on other matters.
It doesn't hurt to put a little disclaimer at the bottom that says, we're not a tax advisor, we're not an attorney.
Yeah.
Consult with your tax advisor or your attorney, right? On
Yes.
matters of
Yeah.
policy or legality.
Yeah. Yeah. Yes.
So I work for Mecklenburg County,
Uh-huh.
and
Thank you.
I'm just curious if amongst the group, how well versed or well educated or informed are the people that you serve about all these changes? Like, are they hearing about it, or are they
So,
not hearing about it?
and tell me your name.
My name's Liz Graham.
Hi, Liz Graham, who works for Mecklenburg County and is asking of her peers in this room and others, what is your estimation of the awareness of the people that you serve about all of these impacts or any part of it? By show of hands, does anybody think like, yeah, my people are aware, we know? Anybody think half of the people that you serve might be? A quarter?
Well, they know about SNAP. Like, we
Yep.
know about SNAP last year, but Medicaid, no.
Yeah.
Nobody knows what's coming.
Yeah, yeah.
In Hood, we don't hear.
So, and this is an example of, it's not that everyone needs to be an expert, but it helps the community for us to be nimble and respond when people understand like the context and like the basic flow of things. Like, these are areas that are under threat. We've got to be creative and adaptive. I cannot, as an agency head, as a foundation colleague, tell you that anyone has a magic solution. We don't. What I can tell you as a way to equip is here's what reality looks like to the best of our knowledge. And it's not pretty and it's not fun right now. We can't stick our head in the sand. In the example of people that are like dependent upon these services, one thing that we can do as a community and as agencies is back to this navigation role. Okay, it's harder to get at these resources. You got to show up twice a year instead of once. You got to fill out an additional piece of paper. Okay, well, let's understand what those pieces of paper are, like specifically. Let's pull information together and reach out to people that we already know are either have those supports and services or could use them and say, like, hey, I'm going to hold your hand for a minute to show you. I'm going to help you get through this. The other thing to know about this that's important, and again, this is one of these details. There is a provision in the federal legislation around accuracy of applications for, well, really for Medicaid and for SNAP benefits. But the gist of it is, if you have an error rate in your total application pool from across any state of above 6%, and an error is counted as you overpaid somebody, you underpaid someone, they omitted their middle name, they left off digit of their address, they didn't sign 1 form out of 10, anything that is wrong gets counted as an error. If that exceeds 6%, then you're going to get charged as a state. We are fining you. Idea being like that is a stick to help ensure accuracy and prevent fraud. Okay. The national average for accuracy across states is somewhere around 10.5%, 10.7, I think. In North Carolina, it's around 6.7%, so we're actually in good shape. But that 0.7% between 6.7 and below 6 is a lot of people and a lot of opportunity for error. On forms, on data entry, like somebody misstrokes a key, puts in a 5 instead of a 4, any of those things. So again, it's an example of like, okay, there's a pragmatic path for us to go down to help ensure accuracy as we're helping people fill out applications, and to let them know, like, you've really, really got to pay attention as you're filling these forms out for SNAP, for Medicaid, for anything. It is unlikely that trend around this idea of fining or incentivizing perhaps accuracy is probably going to spread across other programs. Don't know that for sure, but probably. But again, the answer is the same on our part. We got to help people understand what their options are, how to get through the hoops, help them navigate through it successfully, because they can get there, and we can help them do it. But again, it's an example, and if they don't know, they don't even have a starting point. So follow up, and then I'm going to go.
Sorry.
Yeah.
Ironically, I have to leave early because we are having a meeting internally about this.
Say that louder so everybody hears.
I have to leave early because ironically at 11:30 we are meeting internally about all of these changes and how to communicate them and what to communicate. And so I just wanted to say, I will give my name to everybody. We need to create tools
Yep.
that will work for the people that you all serve. And what we may think works may not work. So feel free to email me, and this is my colleague James. I would love to hear from everybody. And last thing,
Yeah.
shameless plug. We have
Love
a
it.
homes program right now, which is property tax assistance. And it's a huge program of ours. Deadline is November 20th. I would love to share the information with everybody.
I'm going to put you on the spot a little bit. It'd be great if we could have a session like this where we focus on exactly those procedures, those hoops, the nuts and bolts of those processes, so that we can all help people on the ground. Is that okay? We will connect about that. Does that sound like a good idea to everybody? Because this is, and thank you, genuinely, not all county governments are proactive like this. We are very fortunate that we have, the fact that you're going early, leave when you need to have that meeting, means like, we get it. And again, that's an example of an action that a local government is taking because they know, they understand. But you have to have the information to even arrive at that. So this will be critical for people that we serve, that we help them navigate the system as it is. We can not like it, we can try to change it, we can try to change the rules, and we will, all those good things. But in the meantime, what is happening to people on the ground has nothing to do with what we hope will happen in 2 years. Things that we can help with today are the things that we've got to focus on at the same time. Other questions, this side of the room? If it feels overwhelming, no, it's a lot. It is not truly overwhelming. We will find our way through this. We've done this before. It's not necessarily been all at the same time and all the things, but we've got enormous capacity here to draw on. Melissa.
I did have a question on advocacy. Is it more important at the local level or state level, or both?
Yeah. So the question is, advocacy, is it more important at the local level or the state level? Yes. So, money, funding from the government flows basically in sort of this trickle-down dynamic, meaning most of the money that's available in government is collected at the federal level. It is redistributed to states through various agencies, departments, et cetera. And then in turn, the states distribute funds to the county. Now, sometimes it can be different. The county can directly access, what have you. So, the points at which you have like federal decisions being made are important, but you have to know when those decisions are being made. Then you've got state legislators who are setting the patterns for how whatever the funds are can be used or not. The camping ban is an important example of like that is a specific piece of legislation that is important to talk about. And I can tell you that the end impact won't be good for the community. I can't tell you to go and tell somebody to vote no. There's a fine line in that advocacy. You need to talk about, say you're aware, talk about the impact, and register that belief with elected officials and get everybody on your list to do the same. And then finally, at the local level, it's never unimportant to reach out to any elected official or anybody. I would say that it is important that we all know what's going on with county commission and city council. They're the closest to the ground. Decisions like this idea that we're going to, staff is convening to build solutions for enrollment is wonderful. And those kinds of things need commission level support. A lot of decisions are frankly already made by the time they arrive at locality. The state has enormous power. So I won't say it's unimportant to advocate at any level. It's important to pay attention to what decisions are being made on what timeline and to contact the body that has that thing in their hands at that moment. And I know that's not the short answer that you wanted, but it's true. Because we can cause a good decision that we think is a good decision at the federal level, housing funding, and then it gets through the state level and like, okay, that's not so bad. And then at the local level, all of a sudden it gets bungled because somebody doesn't want people visible in some certain area. So they're all important. The sequence is the key. I don't know why I keep pressing this side of the room, like ask a question. Yeah, so one more question, then we're going to go to discussion.
Okay, so I am with a grassroots nonprofit organization.
Yes,
Already
thank you.
Wearing 1,500 hats.
At least.
When you think about advocacy, and I feel like I'm more informed than some,
Mm-hmm.
not most, but when you think about that in a space where you're already extended so much,
Yeah.
and you're dealing with frontline crisis,
Yep.
help me stay in my house, like how much realistically do we say I'm gonna not do this so I can focus on advocacy because
Yeah.
I understand there's a long game.
Yes. Glennis.
Glenise.
Glenise. Nonprofit leader here in our community wearing 1,500 plus hats. Does that sound familiar to anybody? Question is, what weight should I put on and time should I spend on this advocacy in the realm of like, I've got all these other things that are going on. And the answer is, it is about you, but it isn't all about you, and it shouldn't be. The time that I think is wise to spend for leaders is to equip others, board members, your donors, your volunteers, with information that will allow them to advocate and ask them to do so that you have multiplied impact. Especially at the board level, the perception shouldn't be that you are going to do, Glenise, all of our advocacy work. Nor should that be the perception from your volunteers, your donors, the people that you serve. They should look at leadership as a source of information, tools, and like, what do I do with it? That is why in these packets, there's so much emphasis on the messaging. And we've got sample messages broken out for staff, for board members, for volunteers, by constituency, to help you and others say like, okay, this messaging is something I can take, it's a real practical tool and I can share, and it isn't me creating it from scratch. But more importantly, it isn't just you, and like Glennie's like, okay, here's your messaging, and now you're responsible for getting all this messaging out and doing all the advocating. That's not only unfair, it won't work. we got to have numbers. Got to have numbers of the people that you're engaged with now. And we got to get those 150 people that are coming into the community engaged too. It doesn't have to be all of them. But, if across this room we got 10 a day, that starts to add up to some real numbers. How many people have a board that is made up of more than 10 people? How about 8? Okay, we're getting into your board size is one metric to think about. You got 150 people coming into the community, and your board is maybe 6, just to pick a number. There's a lot of potential. And then you start thinking about how many volunteers do we have? It's probably not thousands. How many donors? Some of you, it could be thousands. Most likely it's something in the, maybe hundreds, low hundreds. So these are real possibilities to engage people. But to go back to your great question, and I think this is an example of it's important to have discussions like this because I feel like, there's pressure. I can see it in your face. Like, oh my gosh, it's like another thing I have to do. Is that?
I mean, I get to do it, right?
Yes, you get to do that, yeah.
I feel privileged.
Yeah, of course, yep.
But it's like, realistically,
Yeah.
how do I make it work? And how do I
Yep.
connect with my peers in the nonprofit space who are,
Yep.
leading
Yeah.
organizations to then also understand, I know all of the things that you're doing are important, but this is
Yeah.
something else we need to.
And I think this kind of concern and good question that you have is exactly the kind of concern and good question that probably a lot of people in this room have, which is one of the reasons why it's important for us to keep gathering. Whatever the topic is, this concern that you have, that feels like I'm already carrying so much, and you are, is something that even voicing that, how many other people would have it sounds similar situation. You have the same wonder as Glenise. I feel like advocacy is how do I do that? It feels like a lot. Anybody? So I think that's an example of why it's important, and thank you for sharing that and being vulnerable. But the answer is your role right now is to equip and ask. Does that help?
Yeah.
Okay, so y'all know where to find all of us. So we're not this isn't the only opportunity for resources, tools, questions, what have you. But I do want to move us to a discussion in time we have. So have 2 interactive discussions at table level. First one is around equipping advocates. So thank you for the great setup. And first thing to do is for you at the table, or it can be across the room, pick a partner or partners. And if you're at a table of more than 3, 4, if you can duo up, great. If it's 3 of you, then it's 3 of you. Awesome. In your toolkit, you will see, I think it's on page 13, that there are messaging and talking points that are designed for staff. What I would like you to do is to individually read through those, and then with your partner, talk about what resonated in that messaging for you and what you think you would lift up to your staff, and then ask your partner the same thing. And what we're trying to get to is we're giving you, a baseline, a starting point. How would you adapt that, and how does it land for not only your constituency, but what you're hearing from your partner? And I think what you want to do is get both of you, sharing, here's what I would do, here's how I would adapt this, and then allow your partner to say, well, let me give you some feedback on how that landed. I've chosen staff specifically as the starting point. You've got messaging for board members, donors, volunteers, elected officials, media, whole raft of audiences. But here's the thing. If we can't share this narrative internally with the people that we're in proximity with most of the time, almost every day, it's not going to work past that. So yes, board members are important, and yes, donors are important, but to get the messaging down that will land, our colleagues are the ones that we've got to embrace this together at the core. So we've started there. If you and your partner want to pick up a different constituency, go for it. So let's spend about, 10 minutes or so, maybe 12 in discussion. I'll be wandering around. You can ask me a question. But generally the idea is take a look at the messaging, see what sticks for you. How would you adapt it? Share that with your partner, get feedback. Does that make sense? Okay. I'll keep us on time, hopefully. Looks like some great discussions. We're about 20 minutes out from close. So I do want to wrap this discussion up, but as we talked about earlier, relationships, connections are the roots for collaboration, partnership, movement forward together. So even if you're not talking about anything about what we were putting up at the front of the room to talk about, it's great that you're talking and in proximity to each other and making connection. Lots and lots of great things can happen from that kind of even opening conversation and getting to know somebody that you hadn't met before. So a couple of tables. Anybody want to share some particular insights, things that were aha moments or observations that you think are important? And they don't have to be super profound. They can just be, hey, we noticed this. Yes?
We talked a lot about, we're both in affordable housing. So we talked a lot about how our clients who are generally under that 80% AMI already will need to know more about these benefit changes and how that also how that also affects everything related to their rent and what they're paying and what they can afford. So just kind of talking about how to keep our clients more informed and to be the steward of that information.
Thank you. And didn't catch the first part. This table, I know you're not in affordable housing, but you talked about the people that you serve in the field of affordable housing and why it's important for them to know what's going on, how to inform them, and that's something I take it as something you will try to do in partnership and others. 1,000%, that's awesome. Others. And again, you don't have to have come up with.
Tracy, our table talked about how amazing the sample messaging is in the packet for the different audiences. So thank you and well done on that, and make sure you guys look at that, because that's, as a writer, I know very helpful to have that as a basis. So thank you. Be sure to look at that. Of course, yeah. And again, any materials and resources that we're providing in any of these workshops, they're always starting points. They're meant to inform. They rarely, if ever, will be like directive. They're meant for you to take, and if nothing else, any of that specific messaging you end up using, but have messaging. Get it out. Share it to the people that you are in proximity to. One more. Okay. So we got one more discussion, exploration, I'll put it. And this one is around this, getting back to this idea of, we've got newcomers in the community, at whatever rate that may be. And of course, we have people in the community right now that have been here that are in that bystanders category that we would love to activate as stakeholders, donors, volunteers, board members, advocates. It is not rocket science or a surprise to think about like people that care about the issue I'm working in also probably know about other organizations that are working on this issue, or they may. And I'm going to reach out to those organizations and partner to try to get some of these bystanders in the loop. I want to put an additional tool in your thinking bucket, and that is the tool or the idea that there may be topics, issues, affordable housing, around which there are other issues that are connected, but that you may not think of top of mind automatically. And there are people who care about, and I'll use this as an example because I'm one of these people, about the welfare of animals. And I'm a donor to organizations that care for animals and steward policy and shelters and good things for animals. And I know a lot of people who are similar, and we donate to some of the same organizations. But I'm also aware that affordable housing has an impact on animals because we see in the shelters almost weekly now, because eviction rates have gone up, that there are animals being dropped off at increasing rates. Now, would you automatically think, like, gosh, I should talk to some animal people from the perspective of affordable housing? maybe you would. There are, out of that 150 people, lots of people that care about singular issues. There are probably not as many that would automatically make a connection to an unusual partner, an unusual field. Like, if you care about animals, how about caring about affordable housing as a way to do that and having that discussion? It's not to take the place of the primary discussion ever. Is it a way to help expand and get the number of those bystanders off the bench and into support? Yeah, it could be. So as a way to help do that and think about what are the areas, the topics, the issues that might be connected to mine, I want to show you a tool that may be familiar to some of you, maybe not. It's relatively new, and we can switch to the demo. And it's called Intersections. This is a tool that is on a platform that we've rolled out recently from the foundation called FFTC Forward. And it's available at fftcfwd.net. My purpose is not to plug this platform right now. It is about finding unusual allies and partners. But on this tool, you will see, hopefully, yeah, this little gizmo called Intersections. And it shows 17 topics that are common topics in our community. We were adding to this list of issues. The purpose in us launching this platform is exactly to expand the number of people that are engaged and involved in our community and organizations, regardless of what the issue is that they care about, but to give people a way to do something about something that they care about. Share Charlotte is a primary key partner in this effort. Every organization is in some way a partner. We all want additional support, but when we're talking about advocacy, it is important that we build our numbers. As a way to build numbers, let's think about, in addition to those that already care about our issue on its face, and other issues that might be connected. So this Intersections tool is designed to help lift up some of those connections. Name an issue that you see on the screen. Yeah, any one of them.
I'm Zoe. I work at the Charlotte Community Health Care.
Hi, Zoe. Which issue should I select? K through 12 education. Who wants to pick the next one? Anybody? Yes. Small business. Homelessness, thank you. Third. Yes. Transportation. Now, I don't know how many rooms there have been where people are talking about these three topics together to see where there might be connections. Some, probably. Is that the usual pattern of how we convene, how we talk about topics and issues? No. Usually what we do is we focus on one and we drill down into that. And that's important, and we won't stop doing that as a community. But if we're going to get more people engaged and involved, we're going to get more of us to help move us, we've got to get creative about how we engage them. And that means lifting up all of the options for them, all of the possible ways they could get involved, including the ones that may not be first and foremost in their heads, but still relevant. So I've picked these three topics, and now I'm going to ask it to tell me a little bit about how these three relate to each other. And this Intersections brief it has been created through AI, so I want to acknowledge that. It uses information that we have verified, and we tell it to draw upon, so it's not out in the wide world pulling from who knows where. It's verified data and information from trusted sources. And this one is about how homelessness, schools, and transportation and transit meet. And I'm not going to walk through all the details here because I want to turn it over to you to do this. Idea here is that this is giving a glimpse into how these issues connect to each other. See, there's a quick visual as pairs, little stories about, as examples, how homelessness and education connect, transit homelessness, transit and education. But you get this idea of this cumulative, connected set of impacts, just like the Convergent Headwinds do. So we're trying to meet apples to apples, if you will. We're trying to harness the power of making connections, perhaps across unusually paired topics, to yield more people that care, more organizations that care, and will do something. So, at your table, and we can go back to the instructions. And this tool is available anytime, 24/7. How many people have a smartphone or a tablet? Somebody at each table. I'll invite you to go to the intersections tool. You can appoint someone at your table, or you can all do this, and choose 2 or 3 topics that represent the organizations that you work with and their focus areas. Or if you want to choose some that aren't connected and just are like, let's pick the weirdest ones we can find, great. Generate your brief, see what it says, and have a quick discussion at your table about how, especially if there's an organization or 2 organizations at your table that aren't usually like aligned, how you might connect, how you might find opportunities to either message to people, partner, collaborate in some ways that you haven't done before. And again, I want to caveat this by saying this isn't to replace, like we all should find allies in our lane, so to speak, where there's natural alignment. But we've got to get creative about expanding the pool. We've got to get additional tools and find ways to connect people in ways that we haven't before. And this is one way, an additional way to do that. So take a look, see what comes out of these intersections, and then we'll come back in just a few minutes and lift up some highlights. And then Melissa, I think you're going to close us out. Great.
Is agility the next slide? Okay.
Yes, so
Do you want to just? Okay, then I'll cover. Okay, got it. I'll
So he has
cover secession and then agility core. Okay, got it.
cool.
Thank you.
Try this one first and then this.
Yeah. What's? Okay. Hold on, let me put my glasses.
We're on this one. This is.
Here, do you want me to hand it to Ish?
Yeah.
Okay.
I just didn't see those bubbles.
Okay.
Thank you.
Okay, cool. Okay, yeah, perfect.
Sweet.
Thank you. Great work, my friend.
Yeah.
Yeah.
Thank you.
I know you took some.
Fully leveraged. Okay, just a minute or so more. I know this is short, but again, we're just trying to introduce an idea here. How are you? Yeah, good. Good. Glad to see you. Thanks for coming, as always.
Well, she did some bizarre ones.
Okay.
So I think hers is more interesting.
The strangest.
I did.
Yeah.
On purpose.
All right, I'm gonna pick some strange ones.
Good. A lot going on, which I feel like is like what everybody says.
Do we have the next session planned already?
Succession planning.
Okay. Oh, that's right. Anne Marie's coming.
the data back, and I think October will activate the maps so soon. And then we'll keep building, on portfolios. In the meantime, adding topics, and like if you have ideas about what could be useful, all ears. Yes. Well, yeah. So I'm smiling because you will be able to do. I love that you'll be able to do ideas like that are exactly what I'd love to do. Okay. We are close to time. Highlights from discussions like unusual connections, intersections that you want to lift up, and maybe you're like, wow, I didn't realize there was this connection. And you don't feel, again, you're not solving for a giant world problem. Yes?
I'll just say more broadly, Mark Barrett with Volvo. So welcome to our home.
Thanks for having us here.
Oh my gosh, thanks for being here. When I look at all of these different circles, if I just think of goodwill and if we kind of stand for economic mobility and workforce development, how economic mobility in its truest sense isn't really possible at a high level if so many of those other circles aren't overlapping in it. And I imagine that's a common thread through many of us where the bridges are here. How do we start walking across them and build those partnerships to not say, think of it from an abundance mentality of this is what we do well, but we need your help in what you do well. So I know that might not have answered any of the questions, but
great, yeah.
Grateful for what you guys are doing through the foundation and you, Melissa, through Share Charlotte, to bring all of these things together, to look at ourselves in the mirror and ask, are we doing things from an ego standpoint, or are we trying to meet the needs of our community here and now in a ever-changing landscape that is Charlotte, trying to maintain hope through dark times. So thank you guys.
Thank you. Anybody have one burning realization that they made? Want to be respectful of your time? Yes, sir.
Similar to that, the whole time you were talking, it made me continue to say, stay on mission, whatever your organization's mission is, because this will make you jump off the bridge, but you're not supposed to solve everything. You're supposed to solve whatever that mission statement says. You need help, you need all those other things, but mission creep is real, and you will never sleep again if you try to do everything that was put out here today and all that. Stay on mission, get your board to make sure they stay on mission, all those things.
Thank you. Thank you for today. Thank you for being here, and those of you online as well for joining us. We will be back with the next Agility Workshop, always based on your input and what's valuable from the Foundation for the Carolinas. I want to thank our critical and strategic partners, Share Charlotte, United Way, the Lee Institute. We are practicing what we're preaching, in these rooms: collaboration, partnership, new alliances, new ways to reach people, and this is an example of that will continue to iterate and innovate as we're moving forward. And I'm going to turn it over to my partner in crime, Melissa Hovey.
Thank you, Tracy. Okay, is this on? Yes. Thank you. And really, truly, a round of applause for Tracy. He was the one that brought this topic to our small but mighty planning team that meets weekly to discuss your feedback on what we're hearing on the ground floor. And he did the work and the research to really put this together and make it digestible for all of us to be aware. And I truly believe that Charlotte and our nonprofit sector here is going to be stronger because we're facing this stuff head on and we're talking about it. I want to let you know about an upcoming opportunity for you as a nonprofit to participate in Agility Core. Part of the Agility Together series is Agility Core is, think of it as like a super-powered tiger team for your nonprofit to help you with challenges that you are having with your organization could be around many of these examples below. We launched a pilot in the spring with 8 organizations, partnering your organization with retirees, with community leaders, with consultants to really help you with look at your challenges you're having. And these were the topics that we covered in the pilot. So come to us with what your challenges are. The application is open right now. If you know Allison Keene, she is the program director for this. The deadline for applications is August 28th. We are hosting an information session on the 21st about this so you can learn more. But if you are a part of this, you got an email about this a couple of times already, so hopefully you saw that. But that's a great way that we are just trying to extend the resources and the support to your organizations to help navigate through this time. Okay, on to the next agility, our 15th agility session. Oops, okay, it's coming. Is succession planning. Again, this is for nonprofit leaders. This is what you've told us time and time again is, how do I even start this discussion? How do I even talk to my board about it? How do I start preparing my organizations if I'm thinking about it next year or in 5 years? How does this begin? So if you have been to one of our board trainings, Anne-Marie Forbes is going to lead us in this discussion. And it's a great place. We saw this in the Nonprofit Leaders Survey. This is top of mind for you guys. And so we want to meet you where you are and give you the tools and resources to have this. So we can't wait to see you on September 23rd. And last but not least, please fill out that survey at the end of this that you will get either here on this link or on the email. We read it, we digest it, and we plan for it. So tell us what you want to talk about. Tell us where you're hurting and where you need support so we can support you on this. And with that, have a great Wednesday.